News.
Well, with us now is Nicole Berberian, a spokeswoman for the British Dietetic Association. She's also a nutritionist and dietitian. And Gavin Partington, who's the Director General of the British Soft Drinks Association. He joins us from Westminster. Welcome to you both. Thank you for joining us this evening. Gavin Partington, let me start with you. Your industry makes good profits from selling a sugary drink. So how committed can we really hope manufacturers will be to encouraging us to drink less?
Very, because actually as an industry we make extremely good profits for selling a whole range of low and no calorie products too. And of course in the last 20 years the proportion of low and no calorie products on the market has actually doubled. So the truth is, this isn't about profits per se, although of course we do have a vested commercial interest in this argument, in this debate, but this is about surely taking action across the board to persuade people to have healthier lives. And our view is that this single-minded focus on sugar as an ingredient, or indeed soft drinks as a product category, is not ultimately going to tackle the problem with obesity.
Nicole Berberian, how much should we demonise sugar over anything else that's not great for our waistlines?
It's actually a good point that Gavin made, that actually we don't want to pick out any one nutrient on its own, though we have to make some changes. So if we know somebody's having a lot of sugar, yes, it is something to note and bring down, but we're looking at food groups. So you're looking at reducing those things that are obviously high in sugar, like the chocolates, the biscuits, the crisp bits, the sugary drinks. So it's not actually picking out the actual amount, it's saying bring all these down. Your sugar's going to come down anyway as you do so.
What are the elements that we know that the government isn't keen on a sugar tax? How concerned are you that we're not going to see that?
That we're not going to see a sugar tax? As in, should we have a sugar tax? Is that the question? How much will it help? We're seeing in other countries they're doing this. They've put a sugar tax on sugary drinks in Mexico, and we're seeing that preliminary results are coming in. There might be some reduction in purchasing, but we don't know the answers to that yet. And I don't know if that would work in this country, in our economy, whether it would make a difference.
Gavin Partington, what's the evidence you've seen from abroad at the effectiveness of a sugar tax?
Well, two things. If you take the Mexican example, the soft drinks tax there has led to a reduction in average calorie intake of 6 calories per day, and I don't think anybody seriously believes that that's likely to have a massive impact on levels of obesity. If you take an economy more like our own, like France, where they introduced a soft drinks tax in 2012, although it led to an immediate slight decline in soft drink sales, they subsequently increased in 2013 and increased the following year. So it's not clear to me that soft drinks tax, or a sugar tax per se, is likely to have a marked impact on changing people's patterns of behaviour. And I'm sure Nicole would agree with me that ultimately we should be seeking to educate people so that they recognise the need to have a balanced diet, and they recognise the way to do that. And part of the way they can do it, certainly in relation to soft drinks, is to pick a low or no calorie option, or indeed bottled water. I mean, bottled water sales have been soaring in the last couple of years, and that's all to the good.
What we're trying to do is find ways of changing people's behaviour. That's what we're trying to do through all of these different mechanisms. So there's no question that having lots of sugary drinks isn't going to be good for your health. So what can we do about it to change behaviour? Things like price promotions, things like giving an alternative. So you've got the lower calorie drinks, or you've got moving away from those 2-for-1 offer for the high sugar unhealthy foods, and maybe doing some promotions for the healthy options.
Don't we need to wean ourselves off the taste of sweet stuff, though?
And there's that too. Of course, we're always going to say water is your best drink. That's always the best thing to do. But you can do other basic things like dilute the fruit juice right down in the interim, and dilute the squashes so they're really low sugar levels, or use the no added sugar ones and dilute those down to get away from the sweet taste.
Gavin Partington, many people would say that some of the drinks that your members produce are nutritionally empty. There's no point in drinking them. They're not doing you any good at all. So you talk about education. Advertising surely has to be part of that we need to stop exposing children, don't we, to advertising?
And we stand ready as an industry to support tougher rules in relation to advertising of HFS products to children. But on the question of nutritional goodness, I have to take you to task on that, because of course nutritionists and people from the medical world will refer to that, but of course millions of people make a judgment about whether they want a particular item to actually enjoy, and they're free to do so. What we in soft drinks can do is provide options to enable them to make that choice on the basis of overall diet, so they can choose a low and no calorie option if they wish. Equally, it's perfectly reasonable to have a full sugar product as a treat. There's nothing wrong with that.
I'm supposed to take you to task, but I allow you to do that. Thank you. Just finally to Nicole. Gavin's right, isn't he? We should be allowed to choose what we want. Yes, we need to choose sensibly, but you can't tell people what they can and can't do.
We're allowed to choose what we want, but there's some things that are making it more unhelpful, such as having checkout queues with the high sweets and the sugary foods there. You're hungry, you haven't eaten, and that's what you've got in front of you. You're going to grab that, and your children are at eye level onto that. They're going to go for that. So there are things that we can put in place to make it easier, to make a healthy choice, to help all of us.
Strawberries at the checkout, maybe. Nicole Berberian from the British Dietetic Association and Gavin Partington from the British Drinks Association. Thank you both for talking to us this evening.